Hello GCSE historians and welcome to today's lesson. I'd like you first of all to take a look at this image. This shows us what surgery would have looked like at the beginning of the industrial age. What are the key differences between that image of surgery and the image of surgery we have today? I'd like you just to jot a few ideas down now. Well, firstly, let's begin with the patient. Today, we expect a patient to be asleep during surgery, put to sleep by drugs, anaesthetics. But there are none here. Instead, the patient is alive and kicking. He looks to be in quite a lot of pain and he's being held down by lots of other medical practitioners, shall we say. If we take a look in the bottom of the picture, we can see lots of different medical instruments there. Now, these aren't the precise technical medical instruments we'd expect in a modern hospital. These look more like hacksaws, something you might be using in the garden to chop up some wood. In the background there, you can see lots of people watching this surgery take place. Now, you probably know that we call it a surgery theatre today, don't we? We talk about having surgery in the theatre. And that's a term because people used to pay to go and watch surgeries. So in the background there, we've got a public audience come to watch the surgery. The audience would probably be made up of people with medical interests, so people who perhaps are wanting to train as doctors. You can see it's set out like a theatre, with different rows. You also think today of a modern theatre being very clean, a sterile environment. What do doctors wear? Gowns, capes, masks, gloves, and it all immediately gets binned. They've washed their hands very carefully before they enter that environment. But here, we can see each of the individuals appears to just be wearing their normal clothes, which, to be honest, might be a step up. In this period, a surgeon would wear a surgeon's cloak and he would not wash it. He thought the dirt and stains on it were a sign of experience. And so the more blood stains you had, the better the surgeon you were. You might be able to see there's some kind of white on the floor there. That's sawdust on the floor. Why would there be sawdust on the floor? Well, if you've ever seen someone put sawdust over vomit, it's there to mop up your juices, bodily juices, principally the blood that will come from this bleeding patient. So, overall, what is your impression of industrial surgery from this image? Probably that it looks absolutely horrendous, and you'd be right. Today we're going to look at the first development in improving this surgery, and that's the development of anaesthetics. Now, an anaesthetic is a drug that relieves pain and puts you to sleep. Now, there had been forms of anaesthetic used previously in the Renaissance period and earlier. For example, you might even just get someone drunk before doing surgery on them because the alcohol would put them so out of it they wouldn't realise what was happening. Opium had also been used for a long time. Of course, an opium is where we get heroin from today. So we know it has that kind of pain relief property. Now, from the 1700s, we start to get scientists experimenting with different forms of gases that might provide an anaesthetic, a pain relief. And the first one is nitrous oxide, or what we call laughing gas. And then we get ether as well. Now, both did have anaesthetic properties, but both also had big problems. They could make the patient vomit, the gas irritated the lungs, which caused coughing, even when the patient was unconscious, and they were very, very flammable gases, so they were quite dangerous to use. So we needed a better form of anaesthetic, and this was developed by the man James Simpson. Now, James Simpson was a Scottish surgeon from Edinburgh, and he got together with a group of fellow surgeons and he experimented with chloroform. Very famously, they all inhaled this new gas and probably collapsed, as you can see from this drawing here. They were said to then be found by Mrs. Simpson sometime later underneath the table. Now, chloroform was a much better form of anaesthetic than the previous ones because it was safer and it had the good properties of knocking you out. But you had to make sure the dose was carefully controlled because you don't want to OD the patient, overdose the patient. And you also had to make sure that you were doing it on someone young and fit and healthy because it could lead to some heart complications. Generally, however, it was a great improvement and it became much more popular across the course of the 19th century, particularly after Queen Victoria used it during childbirth. So, chloroform was the first really successful, really popular form of anaesthetic, and it started to transform the way surgeries took place. Have a look at these two images. On the left, we've got what a surgery would have looked like in the late 19th century after the discovery of anaesthetics. On the right, we've got an early form before anaesthetic took place. What difference do you think it would make to a surgery if you could knock your patient out? Well, firstly, they'd be still. You wouldn't need lots of people to hold them down. Because they were still, you'd be able to be far more precise about what you were doing. You wouldn't have to be really quick. Surgery before anaesthetic had to be quick because it was so painful. You didn't want your patient to die from the shock of the pain. Now you could have a much longer surgery. That meant you could do a much more complex surgery. Instead of just being able to pull a tooth, you could actually really get into the body. So, anaesthetics changed surgery in these ways, which surely is great progress, right? Well, the funny thing about the introduction of anaesthetics is it actually leads to an increased death rate immediately after. And you think, well, hang on, why is that? Patients are no longer dying from shock. You can now take great care. You don't have to do such a rushed surgery. Well, the answer is that the longer you take, the more chance there is of germs getting into that wound that you've just made. They hadn't yet solved the problem of infection. So these longer surgeries were taking place in unsterilised environments where the doctors were wearing outdoor clothing, hadn't washed their hands, hadn't washed their instruments, basically where filth and disease would be rife. And so the longer surgeries actually meant there were more infections and more deaths in the short term. They'd solved one problem with surgery, but they hadn't yet solved blood loss, which could still kill a patient, and they hadn't solved the problem of infection. So, today's tasks. I'd like you to complete these 4 tasks on the slide. Good luck!